was put to sleep for a surgery. When I woke up, I realized someone had eaten me out. When I first heard the story, I hung my head in silence for a moment. It had been raining heavily for almost a month now, and the waters were running faster than ever. To make things worse, it was unusually cold for the season. A number of people had gone missing in recent weeks. Many of them had yet to be found. I had little hope of finding the boy alive. Me and a couple of other divers were at the site where the boy went missing within an hour, and a larger search and rescue team located a few towns over was headed our way. We talked with I've been chronically ill since I was a child. I thought visiting a doctor would finally save me, but that's when it got so much worse. My illness was bearable at first. It started with frequent itches and chills, but recently it's evolved into something so much worse. I've been in the hospital more times than I can count, and I take a dizzying amount of medications that require not one, but 2 pill boxes to keep it all straight. I was the kid who spent his summers inside on a respirator because I always seemed to be gasping for air. When I used an inhaler, I often felt worse, like someone was jabbing me in the lungs with tiny needles. My bones were unusually brittle. Not enough to be diagnosed with brittle bone disease, but enough to help keep my family doctor in booming business. I threw up often, but amid the bouts of chronic nausea and fatigue, I always felt hungry. My immune system was running a constant marathon, and I had no idea how my white blood cells kept the pace up enough to keep me living. It didn't seem to be cancer or some other autoimmune disease, but it was something I had made it to high school mostly intact and was fudging my way through a reading quiz during Mrs. Lewandowski's class when I felt a terrible pain in my stomach. I hunched over at my desk, and Mrs. Lewandowski, aware that I basically went to the student clinic every week with a bizarre complaint, let me out of class to phone my parents. "He's gonna spew," I heard Harold Kramer say as I left the class. I pressed my forehead into the cold steel of the lockers as I phoned my mom. Within a half hour, we were in the ER, and I was again being poked and prodded by the staff who I mostly knew on a first-name basis. After several bouts of testing, it was determined that my appendix was about to burst. Great. He's overdue on rent, Dr. Lambdis said with a chuckle. Despite the fact that I've been chronically ill, I've managed to avoid needing much in the way of surgery. From how the doctors explained it to me, my body seemed to be anatomically healthy, but it was like something else was getting in the way of my organs, making them work less efficiently than they should be, but not enough to be a liability. I didn't really care, as I just preferred to avoid getting sliced open. The surgery I did have had mostly been to fix fractured bones, and after a while, I just avoided any and all physical activity, so I never had to go through that again. They prepared me for surgery, and I was able to spend some time with my mom, who wasn't as worried as a normal mother would be in the same situation, most likely because of how often we'd been through this before. Dad was on his way from work, and would likely be there when I woke up. They gave me the gas and I was out. When I woke up, things became incredibly strange. I was really groggy and out of it for a while, but the most surprising thing was that the doctors said I needed chemotherapy right away. I never felt so sick in my life as they pumped me full of the poison, right after coming out of surgery, no less. I began to genuinely worry that this could be the end. Had I had cancer all along and they never caught it? Were my insides filled with tumors? My mom looked white as a sheet in the chair next to my bed. My father's face was completely blank. All they would tell me is that the doctors found out what was making me sick, and this would help. I was getting mad. My dad wasn't there yet, and I couldn't understand what was happening. Getting chemotherapy after your appendix was removed did not seem to be the norm. In between severe bouts of vomiting, I drifted in and out of sleep, and a fever I had never experienced before. This had to be the end. I had nothing left to give. My vomiting turned into sick, dry heaves and empty retches. I could feel my throat cracking from the effort. I'm not sure how many days passed in the ICU, but one day I woke up and Dr. Lambdis was sitting next to me. "Dr. Lambdis," I whispered. "The hell's going on with me?" "Hey there, champ," he said casually. It looked like he too had been through the ringer. Though I had felt terrible before, I was feeling a bit better. "That's why I'm here," he said. He took off his glasses and rubbed his eyes. I'm not exaggerating when I say that, in my 20 years of medical practice, not once have I ever seen anything remotely like this in my life. I've called around, nobody has. I felt scared and drew the thin hospital covers closer to myself. What the hell could it be? Have you ever heard of parasites? I thought back to biology class. Yeah, I don't know a lot, but I know they have a host that they feed off of in some way. Right, Dr. Lambdis said, shivering. Well, it turns out you had parasites living inside you. Normally, there are spots parasites can commonly be found. On x-rays, for example, they may show up as a mass in the stomach or larvae in the lungs. I winced at the disgusting thought that something else had been living with me all this time, something I couldn't see. The thing is, Dr. Lambdis itched his back. Your parasites are unlike any ever encountered. They were moving around inside of you. Actively moving around, living in different parts of you. I didn't understand. Wouldn't I have felt them? Not with how small they were, but it's hard to explain. They were living inside of you, boy. They were like the stowaways in that book, The Borrowers, he said with a sick laugh. I shuddered. What do you mean? It would be easier to show you, but it won't make understanding any easier. He reached into his white coat and pulled a small vial out of his breast pocket. He handed it to me and said, "This is what's been living inside of you." It wasn't a what, it was a who. Inside the small glass vial, on the very bottom of the container, was an almost imperceptibly small humanoid and devoid of any kind of hair. I couldn't believe it. As I turned the vial, the tiny fleshy blob rolled around like a corpse with hands and feet, if you could anatomically refer to them as being the same, splayed out like a rag doll. A tiny human-like figure had been living inside of me. I could hear my heartbeat kicking up on the monitor next to my bed. Dr. Lambdis patted me on the shoulder and took the vial back into his jacket. We're sending samples of them to labs around the world, hoping we might be able to get some answers. Your brittle bones were a result of them hollowing out your bones from the inside. They fed on your bone marrow and would eat away at parts of your organs. On a microscopic level, you wouldn't show any damage until years had gone by because they were so small. That's what happened to your appendix. It wasn't just infected, part of it was gone, eaten away. I felt sick, unable to comprehend how such a thing could have happened. The thought of little burrowers digging through my flesh and feasting on my meat made my skin crawl, and there were still others inside of me at that very second. The chemo should eradicate them. We'll do a full body x-ray in the morning, and hopefully we'll be able to see a full picture of just how many there were. I've explained it to your parents, but we'll be keeping you under close observation until we know you're in the clear. What will happen to the bodies inside me? I asked. Well, once they're dead, your white blood cells should be able to finish taking care of the remains, and whatever's left should be absorbed or pass on through, he said with a grim smile. Dr. Lambdis? I asked. Yes, son. Where did they come from? We don't know. Nobody knows. I fell back into my pillow as Dr. Lambdis left, understanding why my mother's face had been so white. Jesus Christ, they had been eating away at me for years. Even though I've been given a clean bill of health now, there's one thing I'll never be able to answer. Something that will haunt me forever any time I feel a random pain in my body or come down sick from another infection. How the hell did they get inside me? But as Dr. Lambdis was talking to me, I couldn't help but notice his abnormal behavior. He was frequently itching himself. His body would randomly shake as if he had chills. As I laid there, a chilling thought crept into my mind. I remembered being a young child, maybe 4 or 5 years old. I woke up one night to get a drink of water. As I walked past my parents' bedroom, I saw my dad sitting up in bed. He was rocking back and forth slowly, staring straight ahead. His mouth was wide open, wider than should have been humanly possible. "Dad," I had whispered. He didn't respond. He just kept rocking and staring with his mouth agape. I don't remember anything after that. The next morning at breakfast, I asked my dad about it. He had no idea what I was talking about. My mom laughed it off, saying I must have been dreaming, but now I knew I hadn't been dreaming. But as Dr. Lambdis was talking to me, I couldn't help but notice his abnormal behavior. He was frequently itching himself. His body would randomly shake as if he had chills. That's when I realized those were the same first symptoms I had as a child. Itching and chills. How should I tell Dr. Lambdis that I think he needs surgery as well?